ClaimReturn continuity of care technology. A brief overview of how this technology identifies and recovers dollars lost due to improper billing. Let's take a moment to review an actual case study of a gallbladder removal. This procedure includes several different provider claim types, including surgeon, assistant surgeon, anesthesiologist, hospital ambulatory surgical center, and more. For each individual type of service, a claim is filed and paid based on the specific healthcare service provider and procedure code that is billed. For this procedure, over 30 distinct codes exist. A mistake of only a single digit in coding can lead to thousands of dollars being overpaid to one service provider. There are nearly 150,000 treatment codes and 17,849 diagnostic codes used by healthcare service providers to determine the amount to be paid for each service provided. Since medical claims are billed separately by each healthcare provider and received at different times by the claims administrator, it is difficult, if not impossible, to determine whether the services rendered have been correctly coded and billed. However, a retrospective review that recreates the history of a continuity of care does make it possible to identify incorrectly coded and billed claims. Let's take a look at an actual case study of a gallbladder removal to see how continuity of care technology from ClaimReturn can benefit your organization. First, services are performed, claims are filed and paid. Claim data is then sent to ClaimReturn for processing. ClaimReturn identifies billing errors. In this example, the hospital and surgeon codes billed did not match the description of codes billed by the anesthesiologist and assistant surgeon. Once a conflict is identified and flagged, our clinical coding experts review the history and are able to determine which claims are in error due to provider billing. ClaimReturn starts the recovery process. Results. The initial paid claim was $22,755.80. The corrected claim amount was $9,740.80. Claim returned recovered $13,015. Findings. In this actual case study, the surgeon used CPT procedure code 47620. The correct code for this procedure is 47600. This coding error resulted in an overpayment of $246 to the surgeon. The hospital billed the DRG procedure code as 411. The correct code is 416, and preoperative testing is included in hospital charges, resulting in an overpayment of $12,769 to the hospital. Thus, the total identified overpayment in this case for this one procedure was $13,015. Conclusion. This single review of one continuity of care resulted in a return of $13,015 for the employer plan sponsor. According to the Centers for Medicare and Medicaid Services Pilot Audit and Recovery Program, 41% of improper payments were the result of incorrect coding. ClaimReturn continuity of care technology is a beneficial solution for your organization. Please take a moment today to contact ClaimReturn to learn more about how ClaimReturn continuity of care technology may benefit your organization and your employees.